Hi guys, Emily from ARC Seminars here. I'm coming to you guys this week with a top tip that may change your practice. It's certainly going to change mine in relation to working with patients with severe TBI. We all know that TBI is a public health crisis. There are millions of people sustaining TBI every year. However, when we see them in post-hospital or in rehabilitation care, thinking about the amount and the quality of their nutrition is not always everyone's first priority. So a little bit about TBI. It results in a hypermetabolic state that has increased systemic and cerebral energy requirements. But achieving that adequate nutrition to meet that demand hasn't always been first priority. The effect of the timing and the amount of the nutrition that the person receives is crucial. So I'm going to share with you guys some of the findings from a large study of 800 patients who sustained severe TBI in New York State a few years ago, and talk to you guys a little bit about why this is important. So in this study, the researchers found that patients who were not fed within 5 and 7 days of their TBI had a 2- and 4-fold, respectively, increase in mortality, which is enormous. The amount of nutrition that they received as well was also pivotal in this. Patients who had a 10 calorie per kilo decrease in nutrition, so for a 154-pound patient would be like missing a 700 calorie meal. For most people, 700 calories is a normal or a light even meal, would have a 30 or 40% increase in mortality. So the amount of nutrition that they were not receiving can also be catastrophic compared to their outcome. And researchers found that this was held true even after controlling for things like Glasgow Coma Scale score, pupillary score, their intracerebral hypotension, and their initial CT findings, and so on. So, of course, the researchers concluded that nutrition is something that is extremely important and one of the few therapeutic things that can actually have an outcome on a patient's death post-TBI. So I know for myself as a therapist, nutrition isn't something I always feel like I can directly relate to when working with a client with severe TBI. However, finding out information like this is very eye-opening, as perhaps it's going to as I feel that nutrition can be undervalued by therapists. We might give weightier priority to things like ADLs and functional outcomes, which are important, but don't directly relate to mortality rate. So it's very important for us to know that if we're working with someone in the first few weeks after their TBI, that nutrition is going to be one of the things that we should really have a focus on. Perhaps, self-feeding is always going to be a goal, especially for an OT, but perhaps working on things like alertness and arousal, posture, independence with feeding, and so on and so forth, especially again in the first few weeks, is going to have a better impact on our patient's outcome. So this can be something to perhaps think about and help guide your practice with those patients with severe TBI. So thanks for listening. I hope you guys found that as interesting as I did. I've got a link to the article in the bio, so feel free to read. And if this is something that you were familiar with or something that you find interesting, let us know. Any tips, any input is always welcome. Great to hear from you guys.